We have Dr. Ashwini Kumar will be presenting on visual rehabilitation with household artifacts and living space modification.
Thank you very much, All India Science Society, and my behalf Science Society, namely Dr. Satyajit Sinha sir, who not only saved my life, but showed me the way to start a new life ahead. Dr. Satyajit, I will be really indebted to you for life. I had a brain hemorrhage, sir, so I am paralyzed. So Satyajit Sinha sir showed me a new way. He saved my life, sir. The whole society saved me. Now I was starting a presentation. I was a surgeon before, but now I can't operate. So it's a new thing I'm starting. Thank you so much. So I conducted an experimental study in 55 low vision aid patients in Patna. At that time, the patients were not aware of low vision, so the patients were very less. I took the consent from all the patients. No invasive techniques was used, as majority of the patients were from poor socio-economic background. Common household items were used to help the patient with low manners to manage their daily activities. On follow-up, majority of the patients expressed satisfaction and ability to perform simple day-to-day tasks. The researchers recommended usage of these items in low resource households. So there was a bell-shaped distribution of patients who participated in the research in majority of subjects in 2nd to 5th decade of life. Only 1/5 of the subjects were female and 4/5 were male. Subjects came from the variety of occupational backgrounds. Most of the patients attending the clinic are poor, as Mahavir Netralaya, where I'm posted, is run by a charitable trust. 25% of the patients were retired, 13% were students, and 44% were housemakers. So the visual acuity of subjects were overwhelmingly poor and had limited scope of correction using the lenses of glasses. Well over half and half visual acuity poorer than 6/16 both eyes. They all complained of inability to perform daily tasks and unable to benefit from surgery, medication, or use of any spectacles. So the subjects all report difficulty performing common household tasks. However, it was surprising that a majority complained about inability to view mobile and watch television as the causes of highest concern. The other prominent causes of concern were writing and moving outside the homes. A variety of household items were easily developed at home to help them, depending on their needs. Over 30% reported that the cardboard tool for counting the currency was the most useful. It's called Notex. Among others, improved household techniques were arrangement of use of torchlight, more often cardboard tool of writing, and kitchen training, which I'm doing going home from home, how to cook with less light, because they can't cook with holding magnified in one hand. So I teach them how to change the color of the objects and all, color of the room and all. Yes, sir. Then some people it was very useful also when I told them to use the special utensils. The patient satisfaction was rated among a scale of 1 for 5 to among being least and 5 being most successful. A majority of the patients reported a high satisfaction with a 95% rating, a satisfaction rate of 9 and above. Thank you so much. And I feel the low vision aid is a worth trying thing, sir. Satyajit Sinha sir will agree. Because Bihar is our Mahavir Netralaya is a poor state, poor patients are very poor. So I started a new techniques where घर की चीजें आप कर सकते, needle threader, torch light. How I go to kitchen with my driver because I can't walk. So I tell them how to cook with less light, to change the wall colors, to use special utensils and all. Thank you very much. Thank you. Thank you very much.
Very nice initiative. Thank you, Dr. Ashwini.